The relatives and caretakers of children on the autism spectrum need support, and one local speech therapist has transformed her practice since the onset of the COVID-19 pandemic, taking her skills in getting them prepared for life to the next level. We hear more about this in tonight's Health Check segment.
People with autism spectrum disorder may have major problems with both speech and non-verbal communication. They may also find it very hard to interact socially. For these reasons, speech therapy is a central part of treatment for autism. It helps children with speaking as well as communicating and interacting with others. Daniela Rodriguez, speech-language pathologist who works closely with those who have ASD, told Health Check a bit about the work she does and how she's able to assist people who have autism.
We work to prevent, we work to assess, we work to diagnose, as well as to treat speech, language, social communication, cognitive communication, even swallowing disorders, as well as voice disorders, not only with children, but also with adults.
Ms. Rodriguez said over her 17 years of practice, there is one thing that continues to stand out. She says even the families of those on the spectrum need support in assisting their loved ones. This, she explained, really reared its head with the onset of the COVID-19 pandemic, when she was unable to meet with her patients for personal one-on-one sessions and interaction. She added she then reworked her usual approach and took her practice to her patients' homes, not physically but virtually.
I've been supporting my families by providing this parent coaching model, whereby I am supporting the families and giving them strategies and tools to use with their children to then implement and help their children learn language and communicate with them even better.
Speech therapy involves the treatment of speech and communication disorders and can help children with stutters or lisps to pronounce words correctly. Ms. Rodriguez is an advocate for early intervention. As a speech-language pathologist, Ms. Rodriguez says it's her role to assist the parent of someone who is autistic. One of the ways is to get them to assume competence.
Really provide as much support as possible to have this child live and thrive just like any of his peers. So assume competence meaning do not think that because they have a diagnosis of autism that they cannot accomplish certain things.
A speech therapy program begins with evaluation by a speech-language pathologist and SLP to assist the person's communication strengths and challenges. From this evaluation, the SLP creates individual goals for therapy. It's always important to remember in choosing a therapist that person must be a good personal match for your child's needs. With your TTT News Health Check,